Hi all, I'm Sasha and I'd like to discuss how our healthcare system works here in Toronto, specifically Toronto where I'm located. I'm extremely grateful for our healthcare, and as a Canadian it's hard for me to imagine having to choose between surgery and food. But having said that, I think the comparisons to US and other less unfortunate countries make our healthcare seem a little more organized and accessible than it actually is. Not that I'm not grateful, because I am extremely grateful. In fact, if you're new to Canada, you might find the system very different from the one that you were used to in your country. For example, here in Canada, everyone is ideally supposed to have a family doctor or general practitioner, a GP, who coordinates your care for life. When you don't feel well, unless it's an emergency, the first doctor you will see will be a GP, because it's only through a GP that you can get an appointment with a specialist doctor. Even when you do see a specialist, usually anything they learn or find is shared with your GP, your care coordinator, if you will. If you don't have a family doctor or GP, which many in Ontario don't, about 10 to 15%, then your only option is what we call a walk-in clinic. This is a set of doctors in a clinic that are on call, and you would visit the clinic and wait your turn. It's first come, first serve, and the wait times depend on how many people are already there. A lot of clinics let you look up their wait times online, however, so that can help you choose more wisely and be a bit more time efficient. Also, contrary to popular belief, Ontario Health Insurance Plan, or OHIP, that's OHIP, doesn't cover everything. It covers medically essential services, so that means dental and eye care are typically out of pocket. That means paid by the patient. Even ambulances have a cost. They cost $240. However, if you're covered by OHIP, the cost is subsidized and it comes down to $45. Phew. But even if you are covered, please take calling an ambulance seriously. If an ambulance is deemed medically unnecessary, meaning you didn't really need one, you could be charged the full $240, whether you have coverage or not. In the next few videos, I'm going to be talking about medical English. I've had a lot of contact with the healthcare system lately, and I can honestly say that even as an educated native English speaker, I'm often confused by the information I'm given. I hope to make visits to the doctor a bit easier, because if I had to do this with a language barrier, I honestly don't know if I could. So until next time, when we talk about specialists, look out for my next clip about different kinds of doctors. Do you know how to say the words, and do you know what they mean? Until next time, I'm Sash. Thanks.